For the past month, like many other college students, I have struggled with the changes that have come along with the coronavirus pandemic. While these changes have been difficult, I am very fortunate compared to those who are not as well off. From over-the-top medical bills to job losses, those in poverty are suffering to a greater extent than the majority of us are. The coronavirus has exposed such wealth inequalities in America by affecting those of lower socioeconomic statuses to a greater extent. Overall, the coronavirus exposed such wealth inequalities through differences in health and finance. The coronavirus pandemic, to start, has revealed wealth inequalities through healthcare inequities. One way that the pandemic has affected the health of the poor is through requirements for virus testing. Specifically, many testing sites require testing orders from one's primary health provider. For example, the City of Detroit's website requires doctor's orders at drive-through test sites. This can be extremely difficult for impoverished people, as according to a journal article by Dr. Becker, a medical anthropologist, and Newson, low-income patients are less likely to have good health care or a primary health provider. Another way that the coronavirus has affected the poor is through medical expenses. Since the coronavirus has reached the Americas, hospitalization rates have risen. For instance, according to a journal by Dr. Garg and Dr. Kim from the CDC, every 4.6 Americans out of every 100,000 people have been hospitalized in March due to the coronavirus. Lower income families are more likely to be affected by these hospital bills. According to Becker and Newson, for example, low-income families are more likely to be uninsured. Hospital bills can be devastating to the uninsured. For instance, according to a journal by Dr. Scott from Brigham and Women's Hospital, 7 out of 10 uninsured trauma patients are at risk for catastrophic expenditure. Aside from healthcare inequalities, such as testing roadblocks and over-the-top medical bills, impoverished people also have more financial struggles during the pandemic than wealthy Americans. The coronavirus pandemic has exposed wealth inequality by disproportionately affecting the financial situation of the poor. One way that the coronavirus has affected the financial situation of the poor is through job loss. According to the United States Bureau of Labor, for example, 700,000 jobs were lost in March of 2020. For reference, the same report shows that job losses haven't been this high since the Great Recession. A good portion of these jobs are blue-collar jobs. For example, according to the United States Bureau of Labor, the majority of job losses due to the coronavirus have been in the food industry, construction, or retail. The loss of these blue-collar jobs can be devastating to impoverished people, as the majority of employed people below the poverty line are blue-collar workers. For example, according to another report by the United States Bureau of Labor, 40% of people considered working poor work in blue-collar jobs such as service jobs, construction, and maintenance. Another reason why poorer people are being affected by the coronavirus is because they have to pay more for basic goods. For example, poor families that relied on free and reduced lunch to feed their children at school now have to buy their own children's lunches. This could be especially devastating, as according to the National Center for Education Statistics, over 25 million students qualified for free and reduced lunch. Furthermore, impoverished people may also struggle to pay for goods due to price gouging. For example, according to the official Michigan government website, the Michigan Attorney General has received over 500 complaints regarding price gouging in March, near the start of the pandemic. During an event that has required so many of us to adjust our daily lives, it is easy for us to get caught up with our own concerns, whether it's regarding our mental health struggles, a poor environment for online work, or a busy work schedule. However, it's important to remember the people who are struggling the most with the pandemic. During a medical crisis, the poor are facing roadblocks to proper health care. Even more so, the pandemic has affected the financial situation of people who are already struggling financially. In conclusion, the coronavirus has exposed wealth inequalities in the United States by disproportionately affecting those of lower socioeconomic status.